Welcome. So in this video, we will briefly discuss the variety of approaches to psychological therapy and treatment. As we can see from this graph right here, you can see there's been a very gradual increase in the amount of people who received mental health treatment. But that's not it's not a very strong positive type angle or anything. So what we need to do is just sort of keep in mind, that there's a variety of reasons why adults might not seek psychological treatment. And I put some of those examples down below in red font here, like the stigma that one's culture might have to psychological treatment. And you see the second item is SES, which stands for socioeconomic status. So basically how much money one has, in what neighborhood one lives in, levels of education. The third item that is in red font is one's culture. And according, one's culture, each, culture has might have a certain type of philosophy that tells individuals, well, this is okay to do, this is not okay to do. And the fourth item here in red font is support. So support from one's loved ones, one's family, one's peers, etc. So moving on, we can see here, this graph here shows that basically, about 1/3 to 1/2 of U.S. adolescents between ages 8 to 15 with mental disorders receive treatment. So about 1/3 to 1/2. And that's something that needs to be tended to. So let's go forward here. So when it comes to psychological treatment and everything, well, you can see, early in the evolution of psychology, like this painting right here, depicts a mental asylum. And its inhabitants, it portrays those with psychological disorders as being victims. And another painting right here, last century, shows this person ordering the removal of chains from patients at an asylum in Paris. So that can be quite concerning, that is inhumane treatment. And contemporary psychologists would probably all agree that this type of treatment does not help those with psychological disorders. Okay, so this image here, this shows homeless individuals. On the left-hand side under letter A, homeless individuals, about 1/4 have a severe mental illness. And so what kind of support do they receive? What kind of treatment do they have access to? Okay, under letter B here, on the right-hand side here, we see correctional institutions also report a high number of individuals living with mental illness. So even, well, there's something to think about. So I said, here in red font, I said, do you have any thoughts? Okay, so let's talk about various types of approaches to therapy. As you can see here, therapy with children may involve play. So just sitting with a young child and engaging in playful activity. And so, that's the reason why is because they haven't arrived at a certain point of brain maturation that allows them to engage in logical, analytical thought processes, as well as they don't have language skills yet in order to talk about what they are feeling and why they are feeling it. And it's hard for them to interact with individuals. Okay. Another approach to therapy was basically this person, a well-known person, his name was Sigmund Freud. And so patients, they were instructed to lie comfortably on the couch, face away from Freud in order to feel less inhibited and to help them focus. But I put this in italic font. Today psychotherapy patients are not likely to lie on a couch. Instead, they are more likely to sit facing the therapist. And that helps basically neuronal initiation in certain parts of the brain. And that is responsible for better psychosocial interaction. Okay, so we're going to revisit just a little bit about other types of play therapy. So this example here is known as sand play or sand tray therapy. So children can set up a three-dimensional world using various figures and objects that correspond to their inner state. So I put, just a gentle reminder here. One possible reason children have not yet arrived at brain maturation that supports logical, analytic types of reasoning. At this point, they benefit more from environmental interaction. Another type of therapy that we want to discuss is what's called exposure therapy. And that seeks to change their response to a conditioned stimulus. So a person might become conditioned to fear something like, as in this image here shows this person is afraid of rabbits. Okay, so the rabbit is the conditioned stimulus, and their fear of the rabbits is conditioned response. Okay, just below that you see, maybe a type of therapy, basically kind of will have them experience an unconditioned stimulus, like maybe a nice plate of cookies and some milk and everything, and then combine that, just make the association between those cookies and the rabbit, and eventually, hopefully, to elicit an unconditioned response. And remember, when you see that term unconditioned, that just means naturally occurring. Let's go further here. So there, in regard to making associations and experiencing fear and things like that, some people might be afraid of some things like spiders. So exposure therapy can maybe help them, basically elicit less of a conditioned response to those spiders. And one thing we want to look at from the psychological perspective, our emotional reactions are the result of our thoughts. And you see I put that in italic font. about the situation rather than the situation itself. So, what does that mean? Well, how one interprets what is going on in their environment, that can be responsible for the quality of their thinking, which basically results in different types of emotional response. Emotional reaction. So I gave an example. For instance, if you consistently, and I put this in red font, if you consistently interpret events and emotions around the themes of something like loss and defeat, then you are likely to get depressed. So if you engage in the type of thinking and language where you say, well, I can't do this. I never pass this class, or I never win this type of activity, or something like that. You're maybe possibly less likely. More likely to be depressed. Okay, so we're going to switch gears here a little bit and just talk about various approaches to therapy. So therapy might occur, like on a one-to-one basis between a therapist and a client, or maybe in a group setting. As you can see here on the right-hand side, there's a large group of individuals sitting in a circle and basically supporting each other. This is just an image of an individual therapy session. A client works one-on-one with a trained therapist. Okay, in group therapy, on the other hand, usually 5 to 10 people meet with a therapist to discuss a common issue. And so I gave some examples like divorce, grief, eating disorder, substance abuse, or anger management. Those are just a few examples. Okay, so in couples counseling, a therapist helps people work on their relationship. That's another approach to therapy. Okay, so let's talk about psychological disorders and maybe some of the things that are responsible for certain disorders, like maybe drug use. Okay, and you can see, on this graph, we don't have to analyze this, but if you would like to analyze this, please pause the video and view at your own time. So things like drug abuse, substance abuse, things like that. Okay, we always have to keep in mind from the psychological perspective that one's culture is always a factor in how they approach mental health treatment, whether they do or they don't, and how they go about seeking that help. This concludes our video.